Thank you, Governor. And good afternoon, everyone, including the young student that now has a shout out to them. So that partnership with RIPTA is certainly something for us to celebrate. We've done a lot of work to expand access to COVID-19 vaccine, especially in our harder hit communities and in our communities of color. Making transportation available and having the equity-focused clinics that the governor referenced are just two examples of many that we want to do to continue to integrate these efforts across all of our channels for getting vaccinated and making sure people can touch base with vaccine at every point of access we have. This move to provide free transportation to people heading to vaccination clinics is one additional step to remove a barrier and make vaccine accessible as possible. Transportation is a perfect example of a community-level factor that impacts health outcomes. I want to thank the governor and the team at RIPTA for making this happen, and I also want to acknowledge Secretary Pryor and his team for the work they are doing on the Small Business Relief Grant Program. Secretary Pryor and his team has been, along with many others across state government, working closely over the last year with someone named Seema Dixit from the Rhode Island Department of Health, who has valiantly led our entire community mitigation team that has responded to needs across state governments, partnering with entities in the community, and to put a range of efforts in place to help prevent transmission of COVID-19. I want to say thank you to all who have partnered with us and to Seema Dixit and the entire community mitigation team for your tireless efforts throughout this response. I'll turn now to the data. We have 428 new cases to report today. That's out of 22,673 tests that were done, which is a percent positivity of 1.9%. Our weekly case numbers increased very slightly from last week, and true to how we have responded throughout this pandemic, because we are a small state, because we are densely populated, what's key is to focus on our percent positivity. And that is among the lowest in the country. It's been holding steady in that 2 to 2.5% range. That's the critical number for us to follow as a state. We have 138 people currently hospitalized. We've seen a slight decrease in new hospital admissions. And while we very sadly have 4 additional COVID-19 associated fatalities to report today, our fatality numbers have also trended downward. This decrease has actually been more pronounced than our hospitalizations decrease. We're down 94% in fatalities from our peak in December. Because each life counts, we send our hearts and condolences to all of the families impacted, and we use that as a motivator to continue to ensure that fewer and fewer fatalities occur. The fact that our hospitalizations and fatalities are decreasing despite our plateau in cases is not unexpected. This is given the trend we are seeing of more cases occurring among younger individuals. Last week, people aged 15 to 24 years old and people 25 to 39 years old had the highest case rates. And we tend to see household transmission as a primary driver. As I said last week, the biggest takeaway from these data is that in addition to robust testing that we want to continue and treatment being available, vaccines work. We are seeing the impacts of people who have been eligible to get vaccinated take place by having those decreases in hospitalizations and fatalities. Among people who have been fully vaccinated, only 0.1% have later gone on to test positive for COVID-19. Another way of saying that is, of the people who have been fully vaccinated, 99.9% have not gotten COVID-19. That tells you how effectively the vaccines work, far surpassing even the numbers that we understood from the trials. That should be encouragement for every eligible Rhode Islander who has not been vaccinated yet to go out and make an appointment to get their shot. Come Monday, April 19th, there will be no excuses for everyone who is eligible. Tom will give an operational update on our vaccine campaign, but I first wanted to take a moment to address even further the Johnson & Johnson situation and expand upon what the governor has shared. As people by now know, the Centers for Disease Control and Prevention and the FDA recommended a pause in the use of Johnson & Johnson vaccine earlier this week. We are following this recommendation. CDC and FDA are reviewing data involving 6 to 7 reported cases of a rare blood clot in individuals after receiving the J&J vaccine. The Advisory Committee on Immunization Practices, which is a group that advises the Centers for Disease Control and Prevention, met yesterday and will reconvene at the end of next week. The CDC and the FDA are taking this seriously, as they should. But it's also important for us to keep things in the broader perspective. Let's remember, there were 6 to 7 reported cases of this blood clot out of 6 to 7 million Johnson & Johnson doses administered in the United States. This blood clot that has been identified is called cerebral venous sinus thrombosis. And in these situations, it has been seen in combination with low levels of blood platelets, or thrombocytopenia. As the governor has shared, and it's important for us to keep in mind, less than 1 in a million have been at risk for this. In Rhode Island, we have administered roughly 31,000 Johnson & Johnson doses. So that 1 in a million likelihood, which is already very low, is extremely low for us here in Rhode Island. We have come nowhere near administering 1 million Johnson & Johnson doses. One reason why the CDC and FDA have taken this step to pause for this short period of time is so that we can educate our healthcare providers on the signs and symptoms of these rare clots, what the entire presentation looks like, occurring 6 to 13 days after vaccination, not occurring right away in any way, occurring in women, women who are ages 18 to 48. And we also want to help ensure that our healthcare providers have the information they need about how to treat and report these extremely rare cases if they were to present. What's important about that for our healthcare providers is usually an anticoagulant drug called heparin is used to treat most blood clots. But in this situation, heparin may be dangerous and alternative treatments should be given. So we're working with our healthcare provider community in Rhode Island on this issue so that they are fully informed, knowing that it's extremely rare that they may see this, so that they are already equipped with understanding what to do differently if they were to. We just had a call with all the providers last night, and also were accompanied by a Rhode Island neurologist and other experts that we invited to help ensure that providers could have as much of the information that we have. And we're going to continue to make sure that Rhode Island providers have the latest as it unfolds and we learn from our federal partners. So to those people who were vaccinated with Johnson & Johnson vaccine, it's important to know the vaccine has worked, and that you are at extremely low risk of having any of these complications given the numbers that I shared. And if you got your shot more than a month ago, so before March 15th, your risk is even lower of showing any signs of this rare presentation. If you have been vaccinated with Johnson & Johnson in the last 3 weeks, your risk is also still very low, because we are talking about this 1 in a million rare event, and we've only administered 31,000+ doses here in Rhode Island. Having said that, we're continuing to work with providers and to make sure that you're aware of symptoms and what comes with the presentation of severe headache, abdominal pain, leg pain, shortness of breath, along with the clot and with low platelets. Those are scenarios when a provider would be concerned and that you can contact them. It's also important to know that these symptoms and its presentation are different from the mild flu-like symptoms that many people may experience in the few days immediately after receiving the vaccine. The time frame is very different. We're going to be doing some additional communicating over the coming days, so Rhode Islanders who have received the Johnson & Johnson vaccine are aware and informed and able to be updated as we go. The last point I want to make about what has occurred with the Johnson & Johnson vaccine is a point around monitoring and safety. It's key for us to recognize that the robust monitoring system that we have in place at the state level and nationally has worked extremely well here. What you are seeing in this pause with just this very few number of cases out of millions of doses given is this robust monitoring system in action. Federal officials saw a very low incidence rate of a rare health condition in people who had been administered this vaccine. And with their partnership, what we've been able to do is communicate to the public quickly and clearly, pause the administration of the vaccine, make sure that the providers are educated, and conduct a review during this pause so that upon restarting, there can be information available should the federal officials decide to do so. We have a safety system in place, and it is extremely sensitive. It works. This was not hundreds of events. It was 6 to 7 out of almost 7 million people vaccinated, and the system picked it up, and we are responding. We've communicated about it, and we're responding to it. People hearing this should be assured that we have a system in place to monitor to make sure that vaccines are safe and that these systems work. Our Pfizer and Moderna vaccine has been administered to millions and millions more than what we've shared about Johnson & Johnson. And there have not been these types of responses that can help reassure people about its safety. The vaccines we have are effective. They keep people out of the hospital and they keep people alive. I've been vaccinated, the governor has been vaccinated. At my urging, with my family, my mother has been vaccinated, all of her siblings are getting vaccinated. I've been telling all my loved ones who are eligible to get vaccinated. And I encourage you to do the same for yourself and all of your loved ones around you. I do that because I know that these vaccines not only were rigorously tested in clinical trials, but also that they are being monitored closely now, almost more than any other vaccine that we've ever developed, and we have proof after millions and millions of doses have been administered in real time. When we first started talking about COVID-19 vaccine, we listed, along with equity, safety as one of our absolute priorities. It has been a focus for us every step of the way and will continue to be the case.